Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752 right here in the studio, 866-870-5752. And when you phone, you get a free book. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies, actually. And please check out Dr. Darrow's website at www.lastemcells.com, where you can email him off of every page on the site and watch him performing the treatments on videos. That's www.lastemcells.com. And we have Paul.
I'd like to just mention that, I know.
Oh.
Suzanne Summers wrote the intro to this book. She's a great lady. She's one of the greatest advocates in regenerative medicine. She also wrote another book recently that has a very big, 19-page chapter about the work that I do. So she's a big proponent of stem cell and platelet therapy. And God bless you, Suzanne Summers. You do great things for a lot of people and educate. I think she's got like 20 books she's written about health. So she's an amazing person.
Awesome.
All right. So, Paul, you're next. This is Dr. Marc Darrow. Your question is, can you correct a hernia? And the answer to that is, if it's what we call a sports hernia, yes. A sports hernia is typically where the adductor muscle, that's the muscle in the middle of your thigh, attaches to the pubic bone or just has a sprain in that muscle itself. So is that your issue or no?
The issue is in the front on the right side.
Okay. See, I don't know what kind of a hernia it is. If you have an inguinal hernia where the abdominal muscle is being poked through by the peritoneum, then no, I don't fix those. But if it's a musculoskeletal thing, then yes, I do that.
Okay, I had one on the left side, and they corrected it by, I guess they put some kind of a net in there.
Oh, you had the mesh. You had mesh put in. No, I don't heal those type of hernias. The type I heal are when the muscle is stretched out or sprained at the enthesis, which is where it attaches to the pubic bone, or either more distally, further down, just in that muscle where it becomes kind of tendinous and fibrous. So the answer to your question is most likely I cannot help that with stem cells or platelets. There was a surgeon back in the 1800s whose last name was Perret. He was French, and he used a form of prolotherapy, which is an irritant, and he would put it into the hernia between the muscle and in a sense, scar it up. We don't do that, okay? And that's not being done anymore that I know about. There may be somebody in the world who does it, but I don't know who it is. So that is, if it is what I'm thinking from what you're telling me, when you had the surgery on the left side and you had the mesh put in, did that fix it for you? You better?
Yeah, that one worked all right, yeah.
Okay. And if you have the same thing on the other side, then that's probably the way you're going to have to do it, surgically.
Yeah,
now, in my research, people that have had the mesh have had problems afterwards, but hopefully you're not going to be one of those people. So you may ask the surgeon if you can do it without mesh, okay? And then you should look up on Google, look up hernia and then the other word mesh, and you'll see what the results are, okay? It's good to learn how to be your own doctor and get on the internet. God bless you, Paul. It's a pleasure talking to you. Does anything else on your body bother you? Do you have any pain in the muscles, tendons, ligaments?
To you before. I'm going to come in. Yeah, I'm the guy that's 97.
Wow.
97 years young.
Yeah.
What was your main issue before I forget, Paul?
What'd you say?
What hurts you the most?
Oh, I guess my feet and my back.
Okay. Well, there's usually things we can do for that. So I'm going to give you the phone number to the office. It's 800-300-9300, and you can call there and get more specific details about what's going on with you and your body. The backs, usually, if it's your low back, we inject with platelets and stem cells from your bone marrow. A very easy procedure. I think I did about 8 of them yesterday in a row. And it takes me, once I numb up the area on the pelvis to get the bone marrow, it takes me about 15 seconds to do the entire procedure. I had a doctor who was shadowing me from Florida yesterday, and he said, I can't believe how fast you do those. He said, most times when I've seen that, it takes a really long time. And I said, well, I've done over 5,000 of them. So it's something that my team and I know how to do really, really well and efficiently. So if you decide you want to do that, it's a quick, easy procedure. And we just numb up the area, put a needle into the pelvis, and then aspirate out the bone marrow. And then we can inject it. And for the feet, oftentimes I will make orthotics, if that is indicated, which are little pads that go between your foot and the shoe to give it an arch support, and that often will get rid of the pain. Other times I do have to inject the foot with PRP or stem cells. Okay, so I'd have to touch the area, Paul, and find out exactly what your issue is. I can't diagnose over the radio. I wish I could. Maybe someday I'll be able to, but so far you got to come in and see me. So God bless you, man. You have a wonderful day. 97 years young. I've treated many people in their 90s, a couple of that are 100. So we still got time to get you fixed, okay?
Thank you, Paul. Appreciate your call.
Thank you so much for calling in.
Our number is 866-870-5752, right here in the studio. Call directly and speak with Dr. Darrow at 866-870-5752. And if you've called before, call again.
Yeah, why not? So Nita.
Yes.
Do you know why seagulls fly over the sea?
To see what's going on?
Well, probably, but it's really because if they flew over the bay, they would be bagels.
Okay, got me again. All righty.
Do you know what the difference between bird flu and swine flu is?
No.
One requires treatment, and the other requires an ointment.
Oh, my goodness.
Okay, one more.
All right, one more. All right.
Can you take it?
I can take it. Let's do it.
What do you call an alligator detective?
That's going to be...
An investigator.
Oh, my God. That's hilarious. All right, let's go to Don Lancaster with his left shoulder.
We did it. We smoked him out. Oh, my God. We smoked out 6 callers with my with bad jokes.
Don in Lancaster has a shoulder.
Hello
Hi,
there,
Doctor.
Don.
How are you today?
Good. You were almost Dawn in Lancaster with Nita. Right, Nita?
Yes.
That's great. You know, Doctor, I'm 62, and I've been in pretty good shape my whole life. But I was lifting weights in my gym, and I was using the butterfly machine,
Yep.
and I did something to my left shoulder. And if I lift it up, I can't even make it parallel without being in pain.
So you have what's called adhesive capsulitis at this point. And some people call it a frozen shoulder, where they have limited range of motion. Now, the shoulder has the most range of motion in many different directions of any joint. So it's really very prone to injury. And there's 4 major tendons that move that shoulder. They're called the rotator cuff tendons, okay? And you can look that up. You know, I tell everybody, go right to Google. Learn how to be your own doctor. Just Google rotator cuff tendons or just rotator cuff. And then in the upper left corner of the Google, it'll have a spot that says Images. Click on Images, and you'll see those 4 rotator cuff tendons. So what happens is when either you get a labral tear in the shoulder, labrum means lip in Latin, and it's a sheet of fascia that surrounds the ball of the humerus, where it articulates with the glenoid joint. And what happens is when you get either arthritis, a labral tear, rotator cuff tear, or just a tendonitis, it's really painful. And so what people do is they don't want to lift their arm into full range of motion because it hurts like heck. And then when they don't keep moving it, the joint capsule, which is tissue surrounding the joint, I'll use the word, it scars up a little bit. It tightens up, and then you never can move your arm again. And never is a word that I'm not putting a time period on, because for some people it may just be days, for other people it may be the entire rest of their life. So there's an exercise, if you came in the office, I would show you to loosen up your shoulder. We use a golf club or a pole or something like that, a broom, to show you how to stretch your shoulder back into its complete range of motion. And I can talk about it right here, but you won't really get it probably. What you do is you keep this is your left shoulder, so you keep your left elbow straight. You put, let's say it's a golf club, you put the face of the golf club into your hand, and then with your right hand you're going to push the golf club or the broom, whatever it is, out to the side and stretch it up. You'll get to a point where it kind of hurts and kind of feels good. You'll hold it there for about 2 minutes, and then move the arm, your hand, forward and do what's called flexion. The first way is called abduction. The second way is called flexion. And you may not even need a doctor to help you. You may be able to just gently do that yourself to get your range of motion back. That's the best way. I always tell people, if you can help seeing a doctor, you're in good shape, because going to doctors can be really dangerous. Okay?
Okay.
Nita,
I'm
going to ask Nita.
I probably don't need surgery or anything. This is something I could do at home.
I would tell you never to get surgery for that. Yeah.
Good. My
I've had it on both my shoulders. Yeah, I've had it. I've had frozen shoulder. My arms were both locked up where I couldn't lift them at all. This is at different periods. It wasn't both at the same time, from different injuries I've had. And I've injected them with my own platelets and with stem cells, and I've healed them both up. But I use the stretching program along with it. So I've had very, very good success with my shoulders.
About 30 days ago. So if I do the exercises for like an additional 30 days and it seems to help, but it doesn't do it, would I be a candidate for like a stem cell therapy for this?
Well, most likely. I have to, you may be able to do this on your own. You may have to come in and see me for a consult to see how to do this and have me look at it with the ultrasound, see what's going on. So I don't diagnose over the radio. I'm on, you know where UCLA is? West LA.
Yeah, sure.
We're right across the 405 from UCLA. It's very easy to get to.
Oh, perfect.
On Wilshire Boulevard.
Doctor, I really appreciate it. I'll be talking to you soon.
God bless you, man. You seem like you're a very up person. I like you, and I hope you get to come in. The phone number to the office is 800-300-9300. You can call right now. There's people by the phone, and we can hopefully get your healing started right today. Hopefully I already gave you the tips on how to do it yourself. But if that's not working, come on in and I'll show you more. And hopefully we'll get you healed up. If you need regenerative medicine of platelets and stem cells, we can do that. I've done that on myself. Yes, I inject my own shoulder. I've done it a few times. I've done both my knees, both my shoulders, both my elbows, my right wrist. I've had other people do my neck and back because I can't reach back there, and I've had amazing success every time I've done regenerative medicine on myself. It's not going to work on everybody. I have to put that caveat there. The people it doesn't work on usually quit before they're healed. And, they went back to their surgeon who says, that's Boulder Dash, it can't work. Well, it's been working for me with my patients for, I think, 22 years now. And the techniques are getting better and better all the time. We now use imaging with the ultrasound right on the spot to make sure we get the solution that we're using into the exact spot it needs to go to. So as an example, many years ago before ultrasound, when we had our national meetings, we'd all sit around and go, why don't hips heal as fast as other parts of the body? When we got the ultrasound, where we saw that we were putting the needle in the wrong place, we figured it out. You need guidance. You need to see where that needle is going. Doing blind injections into the hip, shoulder, or knee joint is a loser, at least a third of the time. So let's move on to Tracy. And for people who want to call in, the phone number right here, right now, you want to talk to me, is 800-300-9300. Are we going to Tracy?
We are going to Tracy in L.A.
Tracy, how are your fingers doing?
Okay, I'm one of your patients. Haven't seen you in over a year. New problem: ring finger and little finger. I can make a fist, but I can't bring them up. So it's either an extensor tendon that's ruptured, or possibly a pinched nerve in there. Is that anything that you work on?
Well, I have to touch it, Tracy, and move it around to see.
Okay, so you're saying I should come to the office?
Yeah, you know where we're at, because I remember you're the guy that you're the. Let me see what they call that thing. There's the thing you ride on at Manhattan Beach on the boardwalk, right?
What?
Are you that guy?
Bicycles?
Not bicycle.
I don't
it's
know
like a thing you stand on.
Well, you fixed a rotator cuff for me, and you worked on my knees.
Okay.
And you're my go-to guy before I ever do any surgery.
Well, I hope so. I don't see the need for surgery in most cases. There's a lot of different things, as you mentioned, for your ring and your little finger. Have you been been doing any overuse with your hand?
No. It just came about. I actually had to have double cervical neck fusion last January, but and I noticed it after that. So.
If it's after that, after a neck surgery, you're right.
Yeah.
It probably could be a nerve that was damaged during the surgery, because the lower cervical area feeds the pinky and half of the other, the ring finger. So yeah, it may have been damaged.
Anyway, it would be a good idea to come to the office, I take it.
Well, absolutely, because it may be something different. But the scenario you're telling me, getting neck surgery and then not being able to extend your fingers is most likely a result of that neck surgery.
Okay, well, I'm going to make an appointment and come in and see you.
All right, man. I'd love to see you again, and God bless you, and
thanks,
let's hope you can get that. By the way, in the meantime, I'd like you to take some B6, 50 milligrams a day, because that can sometimes heal nerves. Okay?
Did you say B as in beta, B6?
Yeah, B as in boy, 6. 50 milligrams a day, every day. And let's see if that helps you. Even if I treat you, I would have you take that B vitamin.
Thank you, Tracy.
Thank you very much.
God bless you, Tracy. Looking forward to seeing you. And you probably have it, but I'll give it out to you again. The phone number to my office is 800-300-9300. And for those of you that don't know me, you can watch me doing these procedures on videos on my website, which is www.lastemcells.com, www.lastemcells.com. Every page on my website, which is voluminous, has so much information about how to heal. Every page has a spot where you can email me, and I will respond typically that day or the next day to answer your questions. Should we go to
let's
Debbie?
Go to Debbie.
Debbie,
hello,
hi, Dr. Marc Darrow. I understand from the call screener. Hola, ¿qué tal? Pain in your lower back and hips. Okay. How long has that been bothering you?
I have some the disc. I have 3 discs in my lower back that are bulging, and this has been 2 years in the waiting for a medical branch block, and for some reason,
it's called a medial branch block.
Yeah.
Okay.
Medieval branch.
So let me.
Just saying, yeah. So
Yeah.
for some reason, God is postponing it for multiple times, and so hey, I just happened to hop in my car, and you were on the radio, and
okay,
and I was a great believer in the will of God.
Okay, well, that makes a lot of us on the show, and Spirit is the great mover. Yeah.
So I have that.
So let me can I explain a few things, Debbie?
Yes, please.
Okay. Number one, bulging discs don't cause pain. Okay?
Oh.
Almost everybody, as they age, let me do the talking for a minute, okay? So I can get out my thoughts, then you can respond. Almost everybody, as they get older, has some bulging discs, but not everybody who gets older has back pain, all right? Now, if it were a gigantic bulging disc, it would pop out through what's called the annulus, which is the outer surface, and become a herniated disc or an extruded disc, and that can cause pain down either the arms or the legs. But you're just talking about pain in the low back. And that, I'm going to tell you, 99% chance is from the ligaments in the low back, which we can heal by just injecting with platelets from your blood or your bone marrow and giving you stem cells and platelets at the same time. So I'm not worried about you healing, okay? I can't promise you a thing. I never promise a patient anything because I've got to touch the area. But the chances are very high from what you've told me that you can heal with PRP or stem cells or both, okay? So that's a good hope for you. If you want to come to the office and let me just test you out, the phone number is 800-300-9300. I'll repeat it while you're writing it down. 800-300-9300. Okay, perfect.
Yes.
So I'm looking forward to seeing you and giving you some more hope about getting healed up. And that medial branch block, I'm not a proponent of that. That is burning the nerves. I don't like that idea. That just gets rid of the pain. It doesn't fix the problem.
Well, I don't like hiding pain. I don't like being on, I'm on 10 milligrams a day of opiates, and I went down from 20. And I don't like being on any kind of addictive pain medicine, so I'd like to get off of that. Do you have time to mention my abnormal hip joint that I had surgery on?
Yeah, but let me finish up first on the opiates. Anybody who comes in to see me, I'm going to wean them off of their opiates, okay? That means a little bit at a time you stop taking it. Every person that has done that and gotten off their opiates, every single one in over 20 years, has less pain than they had when they were on the opiates. Opiates upregulate the pain receptors and make you experience more pain. When I suggest this to people on opiates, they get mad at me and they go, I can't live without my medicine. And I tell them, you're going to live a lot better without your medicine. It does so many bad things to people. No one, number one, wants to be on an addictive drug. Okay, they feel bad. Number two, it causes constipation. Number three, it causes cognitive decline. Anyway, go to the website www.lastemcells.com. You can email me there. You can call the office at 800-300-9300. I'd love to talk to you, and God bless you all.
Thank you, Dr. Darrow. Thank you, Alex. And thank you, Steve. And listen to our pal Warren Eckstein from 11-1 on The Pet Show every Saturday. I'm Nita Valens, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.